More than 400 people from the Defence Ministry and the Singapore Armed Forces received national awards today. The medals recognize their contributions in helping Singapore fight the COVID-19 pandemic. MINDEF and SAF say the men and women stood ready through the pandemic to defend Singapore's peace and security, as well as safeguard each other's health and well-being. The recipients were also honoured for their roles in helping to stabilise COVID-19 outbreaks in migrant worker dormitories and for their part in contact tracing. Among the awardees are members of the Home Recovery Task Group and the Emergency Housing Task Force.
And we have two award recipients here with us tonight. The first is Colonel N.S. Tong Yi Chuan of the Home Recovery Task Group. He was awarded the Public Administration Medal Silver Award.
And also with us is Commendation Medal winner ME5. Now that's Medical Expert 5, Mr. Jiva Ananthan. He's a Medical Ops Officer at the Emergency Housing Task Force and SAF Head Nurse at the Combat Service Support Task Force. Congratulations, both of you first.
Thank you. Thank you.
Let's start with you, Colonel Tong. You set up the Home Recovery Program. Take us through that.
Yes, the Home Recovery Task Group was set up towards the end of September 2021 with the aim to assist MOH to scale up the home recovery program. Back then, the caseloads were increasing, brought about by the more highly infectious Delta variant of the COVID virus. So there were concerns back then that this may lead to a strain in our national healthcare system. Then there were also questions from the public about the protocols and information on the home recovery program, and this led to the phone lines being inundated. So we sat down with our MOH colleagues. We drew up a three-point battle plan to try to address the situation. First, there is a need to streamline the protocols and to quickly identify people who are suitable for home recovery. Second, there is a need to conduct rapid onboarding so that we can give them quick assistance. And for the more vulnerable patients, we needed to assign them with care managers so that they are able to follow through with them in their recovery journey. Third, we need to scale up the call center capacities, and we have to coordinate our efforts with the telemedicine providers as well as the volunteers so that we can provide assistance to the residents as well as to the patients if they require.
So many phases to that then.
Yes.
And difficulties probably at every stage. And I need to correct myself, that Mr. Jiva Ananthan, not medical expert, military expert 5. Right. Apologies for that.
Well, Jiva, you are a medical ops officer at the Emergency Housing Task Force. That's what you were doing. During the pandemic, the task force actually turned vacant SAF camps into accommodation for COVID-free migrant workers. And those migrant workers were considered essential workers, of course. What was that like?
So this was in early 2020. So as part of the efforts to contain the spread of COVID virus in the dormitory, so what the Emergency Housing Task Force role was actually to bring in dormitory workers from non-affected dormitories to SAF camps. And when we bring them over, what we do is we do routine swab tests so that we can pick up early detection of COVID positive cases, and we can isolate them and of course transfer them to appropriate facilities after that. So this helps to contain the spread of virus. This can't be done in the dormitory, so we had to step in and we have to do this. I also remember that during the initial phase when the virus was, nobody knows how the virus was. We were trying to expand the capacity of one of the camps, and contractors didn't want to step into the zone to set up the bed, fear of getting the virus.
Right.
So we had to go down. I personally had to go down and we engaged the contractors, explained to them on how this virus transmits and what are the do's and don'ts. Gave them protective gears. I taught them how to don and doff the gears, and even told them that I will go in to the zone with you.
Yeah.
Right. Then this gives them the assurance and with that, they did what they had to do.
Yeah, Jiva, this was in early 2020, you were
Yes.
saying? So this was before we even had a vaccine.
Yes, correct.
Yeah.
And before we had ART
Yeah.
kits and all that.
So your experience as SAF head nurse at the COVID-19 treatment facility, that would have given you the kind of medical experience and exposure you needed to be able to give assurance to people about what we know of this disease at that point, as Dawn says, without a vaccine.
Yeah, certainly. So for that, I was deployed for about 2.5 months in CTF. It was in Ren Tso Hospital. And so together with me, there were combat medics and SAF nurses. A mixture of both NSFs and regulars as well. So before we go for such deployment, we actually meet up with Tan Tock Seng staff and management to understand the needs and requirements needed to render support. So with that, we had to train my team, give them the relevant skills to go and operate and to perform their role in CTF. And in the middle of the deployment, what I saw was fatigue was slowly starting to set in. And when fatigue set in, and this was very important to catch, because fatigue will slowly eat away the empathy and the compassion that they have with the task they are carrying with. So my priorities changed, and what we did was focus on sustaining the moral and the purpose on why they are actually here. Secondly is we engage their family members, ask them to send us videos on giving them secretly. It's supposed to be a surprise. So ask them to give us some words of encouragement, saying that they're doing a good job and meaningful job. And we collected this video. We catch them during their shift, in between their shift, because they're all doing shift work. I can't get them on at the same time. So we catch them in between shift, show the video to them. Some teared watching the video. And it actually, then we went back to work. We actually went back to work with a re-energized sense of purpose.
Yeah, they were emotionally charged times for everyone, really, going through what we did. Yichun, home recovery, that was the group that you were part of as well. And for those people who were recovering at home, they needed a lot of connection. You helped to augment call centers to perform onboarding, help desk case management, and so on. How did you actually engage with those patients, sort of recovering at home?
I think one key ingredient was empathy. I think we understood back then that a lot of Singaporeans, a lot of the public, they were very anxious. They had a lot of questions about the home recovery program and the various protocols. So I think it is important for us to have that sense of empathy. And we know that sometimes when they call into the hotlines, they can be rather frustrated. Yeah, and sometimes may even vent their frustrations on the soldiers who were manning the phone calls. And therefore, it was important for us to prepare our soldiers well. We gave them FAQs, the latest FAQs on the protocols. We taught them the importance of empathy, to put themselves in the shoes of the callers, whom could be anxious themselves, who could have loved ones who are suffering from COVID. And I think this helped our soldiers to remain calm and professional when they are answering and engaging with the callers.
Thank you, gentlemen, once again for coming into the studios, and congratulations on the recognition that you so richly deserve on this. Thank you, and thanks for everything you did during COVID-19. It's a great deal of effort.
Thank you. It's a team effort.
We're glad it's behind us now. Thank you.
Thank you.
That was Colonel NS Tong Yichun of the Home Recovery Task Group, and ME5 Jiva Ananthan, Medical Ops Officer at the Emergency Housing Task Force, and he's also SAF Head Nurse at the Combat Service Support Task Force.